I really wanted to take a minute today to talk about how our rehab team, and specifically our speech language pathologists and oftentimes occupational therapists, can interact with the interdisciplinary team members that complete certain sections of the MDS that will really help to best define the patient's needs while they're in the facility. Those sections are really important for, number one, determining reimbursement for the facility and for the therapy components, but also for determining the kind of care that this person needs. And so we as therapists need to provide information that we might not have always provided before to the interdisciplinary team. And that includes our cognitive assessment that we do right at the beginning, making sure that the person that fills out that section of the MDS has that information. And so when we look at that, if we did the SLUMS or the MOCA or another cognitive assessment, using our speech pathology PDPM worksheet will help us to get all the information that we gather in our skilled assessment to those interdisciplinary team members. So there's a cognitive component there. There's section K of the MDS, which is what usually your dietary department's going to work with. So making sure they have the information that they need from your assessment to support coding in that section. And then there's our coding section, so where we're going to talk about any comorbidities this patient may have that make them have some additional needs for speech pathology. And we need to capture that, and we need to do it well. So making sure that you're using that PDPM worksheet and that it's going to the people that need it. So it needs to go to your MDS nurse, it needs to go to the person that fills out section K of the MDS, and it needs to go to the person that does the BIMS or the cognitive performance scale in your facility. So oftentimes that's a social worker and the dietitian or someone like that. So making sure that you're sharing the information that you got on your skilled assessment and ongoing with those folks on the team that need it. That's true interdisciplinary care.